am Dr. Priyanka Maru, consultant, Prime IVF Center, obstetrician, gynecologist and infertility specialist. Today we are going to talk about Cesarean section and various aspects related to Cesarean section. What is Cesarean section? It is a kind of delivery mode. It's a mode of delivery when you take out the baby at term and if indicated preterm also. So basically what we do in Cesarean section we will discuss in a step-by-step method. Let's see first what a doctor sees. There's a skin first. So we put a curvy linear incision in the lower part of the abdomen which is transverse and big enough to take out the baby, which is around 5 to 6 centimeters. Then we see the subcutaneous tissue, cut it down, followed by which we see the fat layer and then the rectus sheath, muscles. We cut it out and open the abdomen, see the peritoneum and then cut and open the uterus lower segment. We put a small incision and open it digitally. We see the fetal parts, usually which is the presenting part as head. Take out the baby, clamp and cut the cord and then hand over the baby to the pediatrician who takes care of the baby's condition presently at the time of Cesarean section. The obstetrician takes care of the mother, sees the stitch line, removes the placenta, does method to reduce the blood loss and then stitch the layer of the uterus in usually 2 layers. Then we see the other layers of the abdomen, start stitching them layer by layer. First, the peritoneum is closed. Usually it can be closed or left as it is. Then the rectus muscle, sheath, subcutaneous fat, layers and then we stitch the skin. So basically the ultimate aim is good wound healing. So what methods should be taken and what measures should be taken to prevent scarring of the stitch line? To prevent the scarring of the stitch line, the most important step is your obstetrician or gynecologist's expertise. She needs to put subcutaneous stitches on your suture line. The incision line should be closed by taking a subcutaneous suture which is under the skin. It is a very thin suture, usually it is never visible and then it dissolves by itself. There is no need to remove those stitches and they heal very good. So the scar is very minimal. The other measures to reduce the minimalization of the scar should be to take a lot of protein diet, vitamin C rich food, some supplements as prescribed by your obstetrician, good environment around the mother, stress-free and aseptic environment around the stitch line. This helps the proper wound healing and it prevents scarring of the suture line. Then we should discuss that what are the methods to minimalize and to get a good recovery after Cesarean section. Minimalizing any kind of complication depends on the food intake of the mother, the antibiotics given to the mother and the environment around the mother. Any new mother should need a very stress-free, supportive, love and care kind of environment. She needs good food, balanced diet, especially which should be protein rich in antioxidants. A lot of salads and proteins and fruits should help the mother. Then she should start exercising if her body helps her to exercise starting 6 weeks later. So basically it's very normal for a mother to feel that she is unfit initially. So later when she gathers the strength, she can start with mild exercises around the upper part of the body and later pertaining to the lower part of the body. She can take help of physiotherapist. She can take help of postpartum physiotherapists who are specially trained for the postpartum recovery of the new mothers. They can start with mild abdominal exercises and rest can take help from the physiotherapists. And then we should discuss that is a planned Cesarean section risky or not. So basically we can't outrightly say that a planned Cesarean section is always risky. Usually the doctor will tell you to wait for the pains to happen by themselves. If they see any indication according to the position of the baby, growth of the baby, the fluid around the baby or any other obstetric indication which are deteriorating maternal health, the doctor can advise you a prior planned Cesarean section which is usually to take care and to make the mother and baby risk-free during the process of delivery. So they can advise you to have a planned C-section on a particular day for the required indication during your pregnancy. So always contact and remain in contact of your doctor during the last part of your pregnancy. Regularly keep in check that whether the baby movements are okay or not, and always report any kind of abnormality you feel during your pregnancy, and your doctor can always suggest you that if you need a cesarean section early or not. So a planned cesarean section is not always risky. Now let's discuss what you need in your hospital bag. Of course, you're going to welcome a new life into your family, so you need few things for the take care of your baby. You need clothes, of course, for the baby. First thing first, you need a cap for the baby. You may need to change cap for time to time, so you need extra pairs of that. Then you need wrapping clothes. If the weather permits, you need blanket. You need dry sheets. Then you need diapers, wipes, and some skin care like moisturizer, rash cream for your baby. Let's discuss what you need for the new mother. First thing, that you need extra set of clothes, at least 2 to 3. If your hospital provides, then good enough. If needful, then you should take wearable sanitary napkins, because after delivery the mother bleeds and it is on a higher side. So to prevent the leakage, you can have wearable sanitary napkins or the large size sanitary napkins you can carry for the mother. Then you need skin care for your mother too. Skin care requires a face wash, then some toiletries like moisturizer, soap, toothbrush, toothpaste, and the other requirements as per the choice of mother. Another topic we should discuss is how important massaging is. So, the old people used to say the mother needs a good massaging for recovery post her delivery. Usually after normal delivery, the whole body of mother pains a lot because she has undergone so much. So now she needs body massage. Post normal delivery, you can start your body massage even as soon as just after the delivery. Just after the delivery, in case of cesarean section, the mother can have head massages, or she can have other parts of body massage other than her abdominal area. So for abdominal area, we would suggest you to wait until your stitches have healed, and minimum 14 days to 21 days. Later part, you can have whole body massage. And of course, one more thing, body massage is important for your baby also. It improves the strength of muscles of baby and helps the baby grow and have a good appetite. All the best for all the information from Prime IVF Center to you. If any questions, you can always contact Prime IVF Center. Thank you so much.